welcome everybody. We'll just run through a little bit of housekeeping to start us off. So thank you everyone. So I'm Trudie Lang. I am a coordinator of the Global Health Network, and I'm absolutely delighted to welcome you all to this really important webinar today. We're delighted to welcome colleagues from across the globe. And as you can see, we have translation running, and I'll just explain that further in a second. But just to say, this webinar today has been brought to you from the team in Brazil and was also set up to be run in partnership with the team from icddr in Bangladesh. Very unfortunately, I'm sure you've all seen it on the news. There's some serious political unrest in Bangladesh right now, and so sadly the team were not able to join us, but we've decided to have this as part one of the series around this very important topic, and we'll be welcoming the Bangladeshi team back very soon, and so you can all hear from them coming up very shortly in another webinar soon. So let me just quickly run through some housekeeping, and then I'm really excited to introduce the concept of Pathfinder Studies to you and how we designed these as a methodology to help people understand their studies and their data and find a good way to extract really great evidence from the studies and the data sets that you want to run. So just to say briefly, we're recording this seminar, and it's going to be available to everybody to look at later on the Global Health Network. And we are running this today in English, Portuguese and Spanish with simultaneous translation. So if you look on the toolbar and click on language interpretation, you can choose the language you want to. So please do that now. And then you can hear this in whichever language you choose to do today. And then use the chat function to introduce yourself, as I hope I can see many of you are already, and also say if you have any issues. And then we also have a Q&A function. Of course, hopefully everybody knows Zoom quite well these days. And we will really want you to take part in this webinar. We've got plenty of time for discussion at the end. So do use the Q&A to raise your questions. And we'll be coming back to those at the end and hope to hear from as many of you as possible. So let's move on and just introduce why we're talking about Pathfinders today. So I'll take you through the background to it in a second and explain what we're up to. I'm then going to pass to Aashna, who's actually using the Pathfinder concept within her own PhD. And she's looking at lots of brilliant examples where the Pathfinder concept could be applied to help teams run studies and get new evidence from their data sets. I think our absolute superstar shining lights in Pathfinders are the team in Brazil, and Larissa is going to talk through their experience of really showcasing and taking up the idea of Pathfinders and applying it to some of their really great examples that they've got in Brazil and Fiocruz. So then we've got a good slot of time at the end to have some Q&A. So that really should set us well on the path to understanding Pathfinders. And so what we're going to do now is a quick poll, I believe, to see what you know so far about Pathfinders, which I assume is very little. Maybe you've read a little bit or found out about it, but this is really the exciting idea, to take you through this concept and then see how you feel about them at the end. So you could quickly click on the poll for us, and then we'll move into the discussion. So it's really exciting to see, just while you're voting on what you know or your expectations are for this webinar. It's really nice to look across the globe and see how many of you are taking part today. And I can see, just looking through the chat and seeing on the map just the great global coverage we've got today, and having this translated as well really opens this opportunity up for everybody. And I can even see we've got a couple of colleagues, hopefully from Mozambique, and so I hope they're really appreciating the fact we're translating this into Portuguese, so they can take part too. So we've got quite a good stretch of who knows about Pathfinders so far, and I'm really looking forward to seeing what that looks like at the end of our webinar today. Excellent. So let's get right into the detail for today. And I'm just going to take you on a quick journey through the story of how we got to the Pathfinders. And I came up with this as really a mechanism for how we could do a lot of what we're trying to achieve with the Global Health Network. So what this is all around is trying to enable equity in where research happens, who leads and who benefits from research. And really the Pathfinders are really a mechanism to help with that equity, because they are a mechanism to guide people through how to do research. And so this target that the Global Health Network has of enabling research to happen everywhere, if you cut it right back, Pathfinders are simply a mechanism to help teams do that. You know, what are we trying to address here? We know that far too studies happen in the Global South, and we know that even of those that do happen across low resource countries, many of those studies were designed and run from elsewhere. And the old forms of trying to tackle this inequity was really teaching people to run one study or work on one disease, which was great at collecting data on a drug or a vaccine. That's all well and good, but it didn't really leave teams with the skills to lead and design and run their own studies. And so the Global Health Network has evolved over the last 12 years or so to be a facility to help people run and lead their own studies. And in fact, this has now been made a WHO collaborating centre because of this mission to try and put research capacity everywhere and be this facility for information sharing. Next slide, please. And so what the mechanisms we have for doing this are many. And the Global Health Network, which we're using now, we're all together because we're part of the Global Health Network today. The Global Health Network is this community of us all. It's a community of researchers and healthcare workers who come together because we're trying to improve where research happens. And so it's this interconnected group of people, teams, projects, topics from across the globe. And these are organised on the digital platform around topic areas and different networks, different diseases, but many different cross-cutting themes like data science or community engagement or research ethics or research in children, outbreaks potentially. And then people can use those different topic areas to find the knowledge that they seek. But the Global Health Network also works in the regions. And today is a living and breathing example of that, because this webinar has really been largely put together by the team in Fiocruz in Brazil, in partnership with the teams in Bangladesh, just showing how much this is really led from the regions now. And we have so many in-person events across the globe, really delivering lots of these ideas in research sessions and clubs around the globe to try and just help this movement of knowledge to support people doing research. And the Pathfinder studies are simply a formulaic way to really support people through every step of doing these research studies. And we'll come to that later. Next slide, please. This is the, I guess, theoretical framework we hang all this on, but it's really straightforward and it's a really strong principle I hope makes sense to everybody. It doesn't matter what disease you're studying. For any disease, we need to have a whole ecosystem of types of studies to understand that disease. And so right now, many of us are involved with the new Mpox outbreak in Africa, but actually I pulled this slide together at the beginning when we were talking about Zika, and then we've used it again and again, but you could apply this discussion to literally any disease, because for all diseases, we need to know how much burden there is. We need to understand the characteristics. We need to do trials to test any interventions. We need to do health economics. We need to do vaccines, of course. We really need to do community-based studies to understand perceptions and behaviours. And of course, all of this needs to come together and the evidence needs to be taken up into practice. And we need to do implementation studies. So we need that whole ecosystem of type of research. But then we know, which is the good news to this, is that it doesn't matter what disease you're working on or what type of study you're doing. We know that the main barriers to doing that research are the same, and you need the same skills to answer those questions. And so it's teaching teams how to set those questions. You know, what is it they're trying to address? How will they measure that unknown? How can they work with the community to make sure they understand and accept and the study's designed really well and they're part of the whole process? How will you analyze that data? How do you extract what you need to find from your data set? And then how will you turn that answer you've got from your data into something that could be taken up into policy and practice? Now, essentially, the Pathfinder study is that cycle diagram stretched out into a process. And Aashna is going to take you through that in a second. But really, I designed the Pathfinder studies to be a mechanism to take teams really through that research cycle and apply it to any type of research. So this is, in a sense, the whole essence of what we're trying to do with the Global Health Network, and the Pathfinder Studies are a vehicle for doing that. Next slide, please. So the Global Health Network is researchers from all over the globe who come. We have over 3,000 new researchers come every week to sign up to find these tools and resources and get the help. But we also work with these major institutions around the globe who share their knowledge. Fiocruz, I'm delighted to say, are really hosting this call today, and we can thank them for lots of the thinking behind this today. But we work with organisations across Africa and Asia too, and many of the big global institutions like CEPI or EDCTP, and even the WHO. Next slide, please. So many of the tools and resources that we deliver are through online education or access to templates, tools and resources. And so when we talk about the Pathfinder studies later, you can use every step of the Pathfinder study. You can find tools and resources to help train you in each of those steps and find the tools and resources to deliver it. And so we've had literally millions of these tools and templates being downloaded. I'm sure lots of you on the call have taken part in some of the training that's available, and have benefited from lots of these resources that are made available. And of course, things like this webinar today and the workshops we do in person are all part of that provision of working with our community of us all, trying to impart this research knowledge so that you can run and deliver your own studies really well. Next slide, please. And so this is really important. This is the evidence behind it all. So that cycle I showed you of those steps that everybody needs to know in terms of how to do a study, and then what we've translated into the Pathfinder process, we know this from studies that we've done. And over the years, we've done really 3 or 4 very major studies to ask these questions. And then more recently, even just this last year, we've done 2, one with Wellcome and one with the World Health Organization. And what these studies reassure us, because we ask, what are the barriers to doing research? What do you find difficult? What stops you doing research? And what we can see from this graph is that it doesn't matter where people are in the world or what sort of disease they work on or what type of study, that there's a fairly homogeneous answer on what those difficulties are. And so we are working to solve those through this access to training, the methodology, being able to work in communities, linked together as networks, and really Pathfinders are one very practical, systematic way of solving some of these barriers in a very step-by-step way that helps navigate each of these areas in doing research and gives you the tools and resources to solve them. So this is the evidence behind why the Pathfinder study process should work and why it's broken down into the steps that it is. Next slide, please. And so what does this mean? You know, we've had the Global Health Network going for over 12 years, and I know many people on this call either helping with delivering this webinar, or I can see in the attendance on here, many people have been involved with this for over a decade, and they have been through this journey. And the idea is that over years, potentially, as an individual or as a whole team, you can work with the Global Health Network to access this training. You could run a classroom session in your hospital on how to set up a study. You could attend a workshop. You could deliver a workshop. You could find people to work with and apply for a grant. Literally, there's different ways that you could interact many times to access SOPs you need, or perhaps an idea of how to do community engagement. So for any individual, any team, the idea is that there's just any number of ways that you can benefit from what you can find on the Global Health Network. And that helps you in your career over time. And so over many years, if you accumulate all this source of information and resources, this should help teams run really high quality studies and become those independent researchers that we're seeking to support. And again, of course, the Pathfinder studies are really a mechanism for bringing lots of these together and helping really access this support to guide and show the path for a particular study. Next slide, please. So again, I'm just coming back to that diagram to show you what we mean, that we can break down what any team needs to know to run a really good research study. And we can break it down to these core areas. And the whole point of the Global Health Network is trying to provide you with access behind each segments of this circle so that you can really build a strong research system in your healthcare system and deliver these elements. And then over time, which is the blue bar, that you can really access potentially what you didn't even know you didn't know. You know, what core outcome methods should you use for your study? How can I work with the community? Is there a data management system I can use? All of these things that you really maybe are struggling with in terms of setting up a high quality study. And then if it works, that all this information could be provided to you and you could be supported. The whole idea is that a researcher in Nepal or Colombia or Peru or Cameroon can run a research study as well as anybody in Oxford or Harvard or anywhere in the world. And so this is our goal. And so I designed the concept of a Pathfinder study quite a few years ago, really, and it's just great seeing it together. And I'm just so excited to see Larissa presenting how they've applied this in a second, and how Aashna's taken this up in her PhD, because it really is a pathway for doing exactly this. So next slide, please. So a lot of this is around equity and access to where research happens and who leads and who benefits. Historically, research has happened at the top of this pyramid, you know, really senior level clinicians or scientists working within a big grant and maybe a sort of very, you know, centre of excellence, of which are few and far between across the global south. So all that bright blue area at the top of the pyramid is where research has happened. But what we're saying is, and what I say to you here with thinking about Pathfinders, is that this is really a way to empower the base of the pyramid and to try and take those tools to maybe community health workers or to a group of hospitals in a group of nurses in a hospital, a group of hospitals in a primary care setting, and think about how research can be made much more accessible and answer pragmatic questions, and really find a way that research can be about measuring what's in front of you. And so this is really another driver behind the Pathfinder process, is to take that ability, break it down and make it really straightforward so that research is something that's accessible to everybody. And this is what we're working on with WHO, really, to say that research should be measuring what's in front of you, and we should be able to put research capabilities into every healthcare setting. Next slide, please. So I'm just preparing the way now to pass over to Aashna, who is going to really take you through this. But just to show you really what we mean by the Pathfinder studies. And so the purple arrow at the bottom is the study that you would like to do. This is your sort of aspirational plan that you want to run a study, and it could be asking literally anything. You could be looking at a malnutrition question, or you could be running a vaccine trial, or you could be looking how to train nurses in a different way, or trying to understand referral pathways. Literally anything. It's a study, a question that you want to ask in your healthcare setting. And so the purple bar on the bottom is your aspirational dream of, this is a study I want to run. And so on the top, the Pathfinder study is the way to help you to do that. It's taking you through that cycle I showed you to set out, okay, how do I break this down into each of these steps? Can I do it? Do I know how to do it? Do I need training? Do I understand this step? What do I need to help me to do it? And so with a Pathfinder study, you can map this process and find out where you need help or what your difficulties are. And then we can create a map of what you need to do in order to deliver your aspirational study. What you're going to hear about today from Larissa is some examples that have happened historically, because what we can also do is run Pathfinder studies retrospectively, actually to show other people how well to do these aspirational studies. So you can use this scheme to help you do studies you want to do. And we can also use Pathfinders to look back and capture what happened in studies that happened before, where we'd like to show others as a real exemplar process. So you're going to hear about both of those today. So I'm going to stop there. I hope I've given you enough of a background of why we designed this and why I came up with this idea of Pathfinder studies to try and help everything we're doing in the Global Health Network. And I'm so excited to listen to Aashna and Larissa, who I hope will really make this all come alive for you. So thank you, everyone. And over to you, Aashna.
Thank you so much, Trudie. That's a really great introduction to the Pathfinder concept. And I'll just take you a little bit more through the actual methodology. So I hope everyone can see my screen. And if at any point I cut out or you can no longer see my screen, do let me know. So I think Trudie has gone through the details of this a bit, but I'll just reiterate that the idea behind the Pathfinder methodology is to really address the issue that there is an inequity in where research happens and who leads it. And what we're seeing is that there's an inequity both in the undertaking of new studies to generate primary data, but also the application of data science skills to ask new questions of secondary data. And I'll explain that in a bit more detail in the following slides. But the issue here is that key barriers to high quality research being undertaken and led by low resource settings are indeed well reported. For example, there's known barriers such as limited access to cutting edge research methods and technology, the skills to apply them, but there's also institutional or infrastructure barriers. I actually had a really great opportunity to visit research collaborators in Nigeria recently, and they noted things like, their entire medical record system is entirely on paper, and that's been a barrier to research and high quality research for them. So that's something that they would like to address, and this is quite common to a lot of settings. And the idea behind the Pathfinder process is that you can take these known barriers and sort of map the process of finding solutions to those barriers. So what essentially you have at the end of it is almost like a recipe for how to do research in your institutions, and that encourages further research. So I'll give you a taste of what it's like to create that recipe. So as Trudie said, and we'll see that same diagram again in the next slide, is the Pathfinder methodology is undertaken alongside planned studies. So in your institution, you ask a research question that is relevant to you, that is important in your settings. And the Pathfinder methodology kind of piggybacks on that to guide you through each step of your research. So that means there is guidance related to things that you can do in each step, links to training, but also it encourages you to document sort of challenges that you faced in each step of your research, solutions you found, and any tools you used. As Trudie mentioned, Pathfinders can also be applied to studies that have already happened. So they don't necessarily need to guide you through research that is actively happening. Suppose you have something that you've already done and you'd like to capture best practices there. You can kind of retroactively document your study through the Pathfinder process that way. And the whole idea behind this is that solutions to most design, operated, and reported operational and reporting challenges in research already exist. It's just a matter of documenting them and really finding out what works well in your settings so that you can share best practices, encourage further research there, and also encourage collaborations. So this is the diagram that you've already seen. Terminology wise, we like to call the host study references the study that you are undertaking in your institution. So this is where you're asking, and hopefully you can see my mouse over here. You're asking a question, a research question that's relevant to your institution. And that same cycle that you saw in Trudie's slides, it's just put out into a linear format over here on this slide. Typical to any research study, you have to engage your community, you have to measure data related to the question you're asking. There's operations involved, so actually collecting data or accessing data that already exists, and you're analyzing that and you're ensuring that the research gets taken up by the community and that it has impact. So here you have pretty typical research outputs such as papers, reports, or things that might be relevant to your institution. Sorry, I'm just checking the chat to make sure nobody has questions. But over here on top is the Pathfinder study, which can be done either alongside your host study, or if your host study has already happened, you can do this after the fact. And the Pathfinder study tools really ask you what happened in each step. So you can describe what you did here. How did you come up with the research question? How did you engage the community? But it also asks you what tools were required. For example, sometimes in asking a question, you have to do a literature review. You have to kind of consult people or experts within your institution and certain tools might enable these things. The Pathfinder process also encourages you to document what challenges were encountered and what solutions were identified. Common challenges include things like obtaining ethics approval. Governments are often quite involved with a heavy hand in certain institutions, so there's a lot of bureaucratic challenges as well. And basically, you should document these and document any solutions that were found. Some distinctions we like to make here are Pathfinder methodologies related to primary versus secondary data. Of note, the Pathfinder methodology, as Trudie said, can be applied to health research of any kind, but the kinds of things you might wish to document could differ based on whether you're using that data that already exists, so secondary data, or whether your host study is collecting new data, so primary data. So for example, as it says on the slide here, Pathfinder studies that map the process of asking new questions of existing or secondary data may wish to focus more on documenting information related to data governance and infrastructure, whereas Pathfinder studies that map the process of generating primary data may not focus so much on that, but may wish to document information related to how you actually defined what data you were collecting, how you designed your survey tool, and such like that. This diagram here is a little bit crowded, but you will recognize this arrow from 2 slides ago. It's the same orange arrow up here, but what it's doing is showing you on the left side in the purple component steps you might wish to focus on if your host study is generating a new information. Typical steps are selecting a study design that works for you and actually collecting your data based on your defined population and target outcomes. And then whereas if you're working with secondary data, so stuff related to my PhD is more relevant to the right if anyone has any questions there. But over here, the Pathfinder process might focus more on documenting things related to identifying a data set that you can use and exactly how you went about accessing that data. How was the data stored? Was it difficult to access and such like that? So the Pathfinder process, as we said, really captures each step and tools and challenges and solutions related to each research step. We've designed a sort of template Pathfinder study matrix to capture these metrics on what activities took place, what tools were used, and through qualitative methods, you can determine kind of where challenges arose as well as solutions to those challenges. The idea of having a matrix is that as more and more study teams use that, you can identify kind of common roadblocks between studies, and host study teams can actually be supported to identify a solution through all the resources that connect us. And here is an example of a matrix. This is by no means exactly what you have to document. This is a very, very generic tool that can be adapted to different study settings, as you'll see in a moment when Larissa presents. But over here, just to give you an idea, the columns list potential key steps in your research, all the way from research planning, outputs and impact, and then how you're engaging stakeholders, whereas the columns here encourage you to document what happened. So the description encourage you to document metrics such as how much time it took, how expensive was it, what resources you used, outcomes, challenges, solutions, and tools related to each step, as well as links to resources and training. And I think Laís is going to go over some important resources you can use where you can find example matrices like these and guidance documents to kind of take you through each step. But the idea behind this matrix is that you have a standardized reporting tool for what you're using to document each step of the Pathfinder process. And finally, I'll wrap up by summarizing this graphic here, which just goes to show that the idea behind the Pathfinder process is not only to document or process map your research, it's to encourage more research, because you'll see what happens is that as soon as, particularly for institutions that may not have undertaken that much research in the past, or may not have that much infrastructure to support research, you'll find that when you start documenting exactly what it takes to do health research. You debunk the idea that, oh, sorry, my timer is going off here. I'll just quickly wrap up. You're debunking the idea that research, particularly data-driven research, is difficult and unattainable, because in reality, it is not. Research questions can be simple. Research methodologies can be simple, and we hope that using the Pathfinder methodology, you'll be able to see that the research cycle is something that anyone can do. So with that, I will stop sharing my screen. Oh, and let me finish by saying also that there are very key people behind the idea of the Pathfinder process. So these brilliant individuals on the screen here, some of whom are presenting today, have come up with this. So I can definitely not take credit for this wonderful idea. It's due to these brilliant minds that exist. So with that, I'll pass it along to Larissa, who will take you through an example or a couple of examples of how the Pathfinder methodology was applied in Brazil. Thank you.
Well done, Aashna. I'm very excited now to hear from Larissa, and just to say that I think I hope you'll be beginning to build a picture, and now you can see some real examples. And it's this concept of Pathfinders being an add-on study or even a study within a study. So you could think of it as if somebody's running a vaccine trial, say, and they're running an immunology study along the side. What we're suggesting here is you've got a study that's planned, your host study, and what you're doing with Pathfinders is running a methodology study on top of it to really understand the process of that study. And as we've said, it can run retrospectively or prospectively. And so this is wonderful to hear from Larissa now, who'll make this come alive with a real example for you. Thanks, Larissa.
Obrigada, Trudie. Primeira coisa, vou aproveitar a audiência.
Thank you so much, Trudie. I will benefit from the Brazilian audience here. I will speak in my own language. Those who may need to adjust their language, please do so now. It is a pleasure for me to be here sharing my experience, because what we are bringing about here is fruit of the collective work of a team that has been working since last year. So the Pathfinder, our team from Fiocruz, they developed the Pathfinder study with two studies developed here in Fiocruz, Birth in Brazil and Vacina Maré. Birth in Brazil 2. So here is the context of our studies. Birth in Brazil 2 is the second inquiry concerning access to reproductive health by women and as well as by newborns. It is organized by the research group in the National School of Public Health of Fiocruz. This first inquiry was a pioneer in its field. It was conducted from 2011 to 2012. It interviewed and collected prontuary data, imaging data from almost 24,000 women. And the objective was to assess their access to prenatal care, birth, and post-birth as well. And in 2021, we began NB2, as we call it here, Birth in Brazil 2, the collection of information from about 20,000 women in about 400 maternity clinics. This includes the investigation of abortion, obstetric violence, as well as many other subjects, including mother's mental health, maternal mental health as well as maternal death and child death. Vacina Maré, it is an initiative by Fiocruz in partnership with Redes da Maré and the City Hall of Rio de Janeiro. And its main objective is to estimate the effectiveness of the COVID-19 vaccine and the impact of the pandemic in the Maré territory, starting in 2020. Maré is a group of 16 favelas or slums here in Rio de Janeiro with a population of about 140,000 people. It's a place with, that faced the pandemic in a very challenging manner. Unemployment, lack of appropriate housing, and this study has contributed to elevated rates of lethality due to COVID-19. So this setting made it so that networks from the community like Redes da Maré, or Maré networks, they organized campaigns, and especially to tackle the coronavirus. And due to the relationship of Fiocruz with the Maré territory, partnerships were strengthened. So NGOs, schools, clinics, and so we started the Conexão Saúde project, or Connection Health. So it implemented various free of charge activities, as well as communication and activities in the territory. So in 4 days, more than 36,000 people were vaccinated against COVID-19 in the Maré territory. Simultaneously with the vaccination efforts, we started scientific studies, which we called the Vacina Maré study. So these are 3 studies on the effectiveness of the COVID-19 vaccine, as well as on its variant, as well as the investigation of long COVID. So there it involves territorial mobilization, intersectorial articulation, data for action, as well as community interventions. So faced with this, well, I will first explain the methodology that we adopted in order to conduct mapping. So the first challenge was with the studies that we have in partnership with Fiocruz, which could be selected for Pathfinder. NB2, childbirth, it is extremely relevant for it. The first inquiry brought about an improvement in public policy, legislation, as well as in healthcare practices, and Vacina Maré with its impact in health, but especially in the territory itself. And here I will tell you a little bit about what we identified in this mapping. So we started with a presentation of the Pathfinder methodology with the main researchers in order to start that mapping and establish, because this is highly complex, right? So which parts would we map? What was more impactful, as well as to align the Pathfinder objective with the objective of the study and establish this workflow. So we started using the tracker tool, started the mapping. We used qualitative methodologies, the triangulation of document analysis, and here it was key to be able to count on the structure of these studies. So these involve websites, reports, as well as projects that were submitted to the ethics committee. These were also basis documents in order for us to actually capture each stage of the study. So in Vacina Maré, we captured, in all the studies, we did that mapping. And in Birth in Brazil too, we focused on the research planning, the access and management of data, as well as on stakeholder engagement. We promoted roundtables, 7 in total, with almost 30 people in each. And based on our mapping interest, we established a script. And the idea behind Pathfinder is that we can use the Pathfinder to also bring knowledge into the team. And this generated an internal workshop on qualitative methodologies, which was taught by Laís. She will address this in a bit. In addition to the roundtables, we conducted interviews with some authors, 10 key actors. It was in a semi-structured manner in order for us to improve on the capturing of the challenges, the solutions, and the description of the activities that was involved in each stage of the study, so that all that could be captured in our mapping. So here we are presenting the first results. These are brief reports, and they talk about what we have identified during the mapping. Here you can find how Birth in Brazil tackled the challenge of conducting research in 400 maternal clinics, not just public ones, but as well as the challenge of entering private institutions. This report includes training logistics as well. This was a big challenge because there were remote locations in the magnitude of Brazil. So how this happened, how to monitor data collection. As this study involved almost 20,000 women, this is quite extensive. How to deal with the challenge of approval in the ethics committee as well. It's not just about having a national committee as we have here in Brazil, but also we have commissions within these maternity clinics. So how to tackle that and what impact does that have in the time for collection? This was also done for Vacina Maré. It analyzed the techniques that they use to mobilize the community. It includes a big lesson from inhabitants from these communities becoming research articulators. They started working with the data analysis even. So many lessons and how we can bring these experiences to other studies. We don't need to start from scratch again, and we can always learn from studies of this magnitude. So here we talk about challenges, solutions, and lessons learned, which are not in the scientific paper. This background information is not described in it. This was possible due to the Pathfinder and due to the mapping that was conducted. There are many ways to record the lessons of the study.
An important step for the mapping at the first stage was to record all of the people and institutions involved in each one of these studies. That list made it possible for us to observe all of the possibilities for building these panels. So for Birth in Brazil and for Vacina Maré. And we recorded the profile of those involved, the organizations that were involved and that were essential for the success of these studies. And we also recorded the weight of each one of these participants for the creation of the study. Next slide. Another relevant result that we've had after building the mapping was the establishment of the step-by-step guidelines. As researchers, we face many challenges, and these generate lessons. The mapping process also made us realize that what we were developing could also help others. So, for example, the creation of a dashboard, it could be developed by other researchers, but we can already show them the path. So we developed toolkits, we developed guides on the methodologies themselves in accordance to the Pathfinder methodology, of course. It has that responsibility of supporting other Pathfinder studies across the world, and that is why we developed that step-by-step guide through our mapping. All of that aligned with the content.
Also based on the content that we developed on the dashboard, this can be made into a structure, as well as the mapping of the stakeholders. It also was reflected on that. It also made it possible for us to develop other toolkits and how to conduct science in periphery territories. And now, sharing. It's always important to see the power of sharing and see ways that we can share experiences, not just through the reports themselves. And here we have another structure that we use for that. It was extremely valuable, and we were able to share that lesson and experience through a workshop. We sought the information from our internal team, and we realized that what we were building throughout that path was extremely valuable. So we developed a workshop with Brazil, India, and Malaysia on the use of these tools for community engagement. So throughout the mapping, we also established two very important things. I'll start talking about HeadCap. It is a software for electronic data capturing, and Birth in Brazil also uses it for research management. And we realized that there was an audience for that. When we opened the registrations for this seminar, we realized that interest was high.
In order to do research, we need to develop the development of softwares, not only for data collection, but we can also use that software to manage the research effort all along. The panel showed us that there are nearly 80 people involved in the Birth in Brazil. And how are you doing that? Another webinar where we shared experience with the TGHN's data set was the use of the web. So we promoted this webinar in a partnership, sharing this experience, analyzing the results from Vacina Maré. So there's still a lot of things within this effort that we can share, but here it's just a little bit of each one. Next slide. And now everything I'm saying here to you'll have access to more details when you go to our webpage. It's on TGH and LAC, LAC, and where you will find more information about the methodology, but also we keep that updated with each new outcome of that mapping effort. You will also find statements by all of the researchers in the Nascer no Brasil or Vacina Maré who participated in the Pathfinder study, and also they will be sharing some of their experience, the impact they had both individually, but also for the organizations. These are some of the moments that were promoted by Pathfinder to map complex studies. That contains document analysis and panels and interviews. So they have started really a process of individual and collective evaluation. They are very intense studies. And the evaluation step, which is when you stop to think and look at what you have put together, and also to realize the construction that has been implemented and all of the accomplishments. So we see that mapping effort brought content that can be used in other tools, but it also brought forth this moment of reflection amongst different researchers. The objective was that these lessons that were learned could actually instruct other research efforts. That's the purpose when we're mapping a research that is still ongoing or which has already been through some of the these stages, and we believe that we can contribute for future studies to go through a similar process. And this feedback, obviously, when you go through these experiences, it's interesting that we can actually incorporate, we can bring in innovation into the research effort. And the Pathfinder methodology has proven to be very flexible. The construction process was different for each study, but then it showed that the tool really accounts for the needs to adjust to each specific study interest. And I'd like to share some special thanks. I'm just the spokeswoman for the team construction, the Pathfinder team within Fiocruz, but also the team which is very active with TGHN, and special thanks to the partnership by the Vacina Maré team and Birth in Brazil 2 team for having added to the strength of this mapping, but also for opening the door for us to access the methodology. And then we see there are still many more results that can be achieved. So with that, I'll pass the floor to Laís, who's going to be sharing with you a little bit of our plans concerning the Pathfinder within the TGHN.
Thanks, Larissa. That was absolutely brilliant. So now let's hand over to our next talk from Laís. Thank you very much. Larissa, do you want to pick it up if she's having difficulty?
And now I'm speaking English, I'm sorry, guys. Então, enquanto a gente está resolvendo aí o áudio
So
da
while we
Laís,
sort this
e assim
technical
que
problem,
estiver disponível, Luís,
Laís,
you can feel free to pinpoint
as soon as
us,
you're ready, Louis, please.
Então, muito obrigada. Vou dar continuidade e apresentar a vocês o nosso
Okay.
planejamento aí de uma série
So I'm
de
going to
atividades
pick it up from
Pathfinder,
now, and I'm
para
going
que
to
a
show
gente possa
the
apoiar
plan we have
outros
for
estudos que
Pathfinder
têm interesse em estar desenvolvendo
activities,
essa
so we can look at
metodologia
other
com as
studies that
pesquisas.
are interested in
Pode
developing this
passar.
methodology for their research.
Obrigada. Então, a gente vai promover o
So we're going to be
esse é o
promoting
primeiro webinário que a gente fala sobre as
the first
ferramentas
webinar.
e os
This is the first
benefícios
webinar where we're
da
talking about
metodologia,
the tools
mas
and
a
the
gente tem
benefits
aí
of
na
this
sequência
methodology, but we still have
workshop em que a gente quer
a
promover para que a
subsequent
gente
workshop
possa
we
o
want to promote
desenvolvimento
in
daqueles
order
que querem
to
trazer essa
help
metodologia para
develop
sua
those who
pesquisa
are willing
dentro
to
da
bring
sua
this
região.
methodology
A
into
gente vai estar
their
oferecendo
methodology, into
workshop
their
no final de
research in the
agosto,
region. So we're going to be
para que
sharing,
possam
we're going to be
estar
offering a
trazendo
workshop
mais
in late August,
detalhes sobre a
where we
construção
will be
do
sharing more
Pathfinder,
details
por
about
onde que a gente
Pathfinder's
começa, né? A
construction
gente
and
trouxe
how
aqui um
we
display
start,
muito
where we
breve
start.
sobre essa
This is
estrutura,
just a
mas a gente
brief
sabe
overview of the structure,
que
but we
quando a gente
know
vai fazer o
that
mapeamento, tem
whenever
muitos
we're actually
detalhes que
starting to
envolvem
do our mapping
esse
effort, there are
processo.
many
Então, a
details
gente vai
involved in the
oferecer
process. So we're going to be
essa
offering
série
this
de
workshop,
atividades, primeiro
this
workshop
series of
em
activities, which will
português
start
e
with this
espanhol.
workshop. It's
Então,
going to
a gente
be
vai estar trazendo aí,
offered
principalmente,
in
nós já
both Portuguese
temos
and
na região da
Spanish.
América Latina
We
um
already
carinho dos
have
nossos parceiros
our
desenvolvendo seu
partners in
próprio Pathfinder,
Latin
e a
America
gente vai
and
estar
in
oferecendo,
Caribbean
então,
region who are
essas
developing
atividades no primeiro
Pathfinder. So we're
workshop,
going to
para estar
be sharing
montando
this activities
e
through an
trazendo
initial
uma
workshop so we
harmonização de
can
conhecimento desses
provide
conceitos.
knowledge
O
harmonization.
segundo
We can
workshop aí
harmonize the
com
concept
base,
across
claro,
different
no
areas.
desenvolvimento do
And the
estudo de
second one
cada
is going to be
centro.
based
A gente vai
on
estar
each
trazendo
center's
segundo
study
workshop
development. So we're
em
going
que
to
a
be
gente vai
bringing
estar
this
abordando com
second
foco
workshop
à
where we will be
ferramenta. Então,
addressing
dentro de
the
cada uma das ferramentas
tools
que a
more
gente
specifically.
utilizou, não somente
Each
os
of the
termos de
tools we
referência,
use
o
is going to be
protocolo, mas como é que a
shown
gente
and
pode estar
elaborated,
aplicando isso.
the
E por
protocols,
fim,
and not only
claro,
that, how we
conforme
can
a
apply that. And
necessidade
later
e esse
on,
processo, a
according
gente
to
quer
the
promover
needs that
terceiro
arises through the
workshop
process,
em
we
que a
are
gente
thinking
fala pouco
of
sobre a
promoting a third
identificação dos
workshop where we
recursos.
will be talking
Então,
about
todos esses recursos que eu
recognizing or
apresentei para vocês,
identifying the
alguns,
resources, all of
né,
the
a gente
resources
já
I've
tem
already introduced to
definido de
you.
início a partir
For
da
some of them,
necessidade, o
some
que
of them
o
are
estudo, por
already
exemplo,
defined at the
Nascer no
beginning
Brasil, Vacina,
based
Maré,
on the study
tem
that's,
interesse em estar evidenciando,
for instance,
mas
Brazil,
que
Birth of
ter
Brazil and
essa
Vacina
percepção
Maré.
do que pode gerar recurso e o que a gente
We
pode
will
estar
use that
construindo a
to
partir do
see what can
mapeamento,
become a
isso sim
resource and
é
what we
uma
can
forma, é um olhar
construct on the
a
basis
ser
of that tool.
desenvolvido e é
So
o que a
it's
gente
going to
quer
be
trazer
a future
nesse
outlook to be
terceiro
developed,
workshop.
and this
Ao
is the
longo
content
dessa
intended
caminhada,
for
dessas
this third
atividades,
workshop.
a
In the course
gente
of these
já
activities,
começamos a
we
promover
have
algumas
already
sessões
started promoting some
com
sessions,
encontros com esses parceiros, mas que a gente
encounters with
quer
these
trazer isso de uma
partners.
forma
And
sistematizada
we want
para
to
que ao
do
longo
that
entre os
in a
workshops a
systematized
gente
manner
tenha
so
algumas
that
sessões, alguns
in
encontros,
between the workshops, we will
conforme
also
a
have some
necessidade
sessions,
ou
some
quinzenal ou
encounters
mensal do
according
interesse
to the
desse encontro
need.
e
It
por
may be on a
participando do
fortnightly
workshop,
basis
para que a
or a
gente
monthly
possa ir
basis
tendo trocas ao
for those
longo
who are participating in the workshop, so we can
desse processo.
continue to have our different exchanges in the course of the process.
Então, eu vou contar pessoal no chat, manejando,
So
que aqueles que
through
têm
our chat
interesse
feature,
em
I'm going to
estar
ask
conhecendo
those of you
mais
who are interested in getting to
como
know
implementar
more
essa metodologia no
about
seu
how to
próprio, na sua
implement this
própria
methodology in
pesquisa,
your
se
own
ela já
research
começou,
or
se
research
ela já
centers,
passou, se
whether
é uma
it's
pesquisa que
already
está
started,
começando
whether it's
agora
already
e ainda
finished, or
vai
whether it's
acontecer,
just
mas já
starting
quer estar
now and it's still going to
estruturando
be
isso para ir
implemented. But
identificando as suas soluções e poder
when you
estar
are already trying to
incorporando
identify that,
esse
to
processo,
identify the
fica à
solutions
vontade,
to be
pode
incorporated
direcionar
to your
aqui, tem
process
o
field,
código,
please feel
tem
free to
também o
do so. You
link
have a
que vai
QR
ser
code here.
compartilhado
There's
no
also
chat
a
com vocês.
link
Se
that's going to be
inscreve
shared
no
through
nosso
the chat
workshop,
feature.
que a gente vai
So
fazer
please join our
um
workshop.
convite
We will
com mais
be liaising
detalhes
with you,
para
sharing
que
an
vocês, para
invitation
que a
with
gente
more
possa fazer essa
detail,
construção em cima da
so we
necessidade
can
de cada
do this
pesquisador
construction
interessado
together
em estar
based on
utilizando a
each
metodologia.
researcher's interest
Muito obrigada,
in using
Trudie.
this
Passo para
methodology.
você.
Thank you very much. Trudie, I pass the floor back to you now.
Superb. Thank you very much. Well managed, Larissa. So let's have a look. We've got some really great questions in the Q&A, and we can pass the microphones to people. So the first one we have is from Alexandra, and I always like to hear from people. So if you are happy to ask the question, Alexandra, I think Louis can open the mic for you. So do go ahead. And then we can pass that round. I like I love the way the question's phrased. So I hope Alexandra's feeling brave enough to ask the question. Do you have the mic? And can you speak? Is that okay, Louis?
Yes, yes. Hello.
Hello, good to hear from you.
Hello.
Well,
I found it very interesting. I really like it. And I'm thinking about implementing it in my research. So I was wondering if where I could find, for example, previous experiences in my area of research to compare with, or to know from where to begin. So I would like to know if is there a repository where I can find it, or should I look for peer-reviewed papers? And also, if we are dealing with something that can change, so suppose that I am implementing a Pathfinder framework in an intervention, but difficulties are coming. So it's not, it's happening, right? It's happening now. So difficulties are coming, and I am taking the implementation science perspective. So how should I adapt? Because it's not just a matter of mapping, but mapping something that is changing dynamically, right? So how should I interact the Pathfinder framework and implementation science perspective?
that is just brilliant. So thank you. I think implementation science is almost the perfect scenario for this. And we didn't line up Alexandra to ask this question, I promise. So there's a few that I could spend ages answering this for you, but you're absolutely right. And this dynamic, even though we draw it out like a process, the whole point with studies is they're very rarely linear, and they are dynamic, and that's the point. And you don't always have completely solved one area before you move on to the next. I think a great example is, say, community engagement, which should be something that happens throughout your study, or planning your data analysis. You write a data analysis plan, things change. So this is the point. It's the research process is dynamic, and we really want to be able to capture this. Then there's two answers, and just to completely confuse everyone with what we mean by Pathfinder studies, we've developed a very simplified version of the Pathfinder study, which Aashna's smiling because already I've got it. I'm going to put it in the chat, which we call 1000 Challenge. And the idea of the 1000 Challenge, it's exactly the same as Pathfinder, except it's a really simplified version of those key steps. And we are going to generate a Pathfinder area on the Global Health Network. Aashna needs it for her thesis, and the nice thing with this is a really new methodology still. I came up with this idea when we were putting a funding application together a couple of years ago, and it's just great to see how it's all coming together, and the team are applying it in different ways. So it's still a new concept, and we've got a paper that we're submitting and trying to get published on it, but it's new. And so just wonderful if people want to take it up. So a very straightforward way of applying it, especially to implementation studies, is to use the 1000 Challenge system, because it is a Pathfinder study. It's just we've called it 1000 Challenge as a nice, more simple way of displaying it. But the Pathfinder toolkit that Aashna showed you is exactly the same. It's just a slightly more methodological, sort of pure research method science approach. So if somebody wanted to do a PhD alongside a big study, or you've got people with the caliber of Larissa and her team and Aashna, Pathfinder as it stands is a really excellent tool that could be embedded with a big implementation science program or any other group. You could take it on now. There's plenty of people around to help you, and you can use it. If it's a less inexperienced team and you're really wanting it to use to help guide you along, then the sort of 1000 Challenge approach is a kind of show and hold your hand through it version of that. I'm going to pass you to Aashna, because I'm sure she's got something to add to that answer.
No, I'm so glad you mentioned the 1,000 challenge because I was about to. Because the 1,000 challenge and the Pathfinder are very, very related in that the Pathfinder just takes that one step further really and asks some more details related to each step. I've also, I think, Alexandra, I've responded to your second question in the Q&A with a link to a track. Maybe I'll just post it in the main chat. Actually, this is where one of the trackers tracker sort of or matrix templates lives. And I know there's additional resources through the Fiocruz hub. There's a proper toolkit that can kind of lead you through each step and guide you through. But the idea of the tracker is not to be like a standard. It just gives you an example and you can totally modify it to suit your needs. It just gives you an idea of things that might be important to document in each step. So, and because it's a very new methodology, there isn't a lot published. I know you asked about sort of peer-reviewed publications you can look at, but the hope is soon there will be a lot of literature on this as well. I'll let Larissa or Laís add to that if they'd like to.
Yes, I do. Just a quick complimenting that. That's the idea of the workshop. So people who are eager to test the methodology, the study, come join us in the workshop, in the first workshop, sign up to participate. We're hoping to have more Pathfinder studies in order for us to make new studies where we can compare what are the challenges among our research, right? So thank you so much. That was an amazing question.
Yeah, brilliant. It's a really great start. And there's a methodology area in the Global Health Network, and we'll make sure it's there as well as on the Fiocruz site, so it's just more visible everywhere. And then we are setting up a Pathfinder area as well. So yeah, I hope that answers. Alexandra, is that helpful?
Yes, yeah, thank you so much. I look forward to attending the
Brilliant. Well done. Thank you. So Jacqueline, over to you.
Thank you, Trudie and Larissa, Laís and Aashna. My question is in regard that when you have a very complex study because it lasted several years, but also because it had several components, then there is a recommendation to do a Pathfinder, but how do you decide to include the whole research or just a part of it? And then which part? How do you make those decisions? Over.
Yeah, thank you, Jacqueline, and lovely to see you as ever. Of course, the idea of this is a methodology that anybody can take up and use, which we'll make really clear in the paper we're trying to put out. And of course, the point is that you can apply it to a really simple, straightforward, pragmatic implementation study or a 3-year, clinical trial product development program, or even a series of studies. And you can absolutely choose if you just want to focus a Pathfinder study on one particular element. So the tool should be really adaptable and totally down to you. So it's really for, the idea is that, any team can take on running Pathfinder studies themselves. So it's just for them to take on and use. So we're just wanting to make available the methods and the approaches, and then teams run off and do it. What we're also wanting to do is create, as we are in the 1,000 challenge, which is a simplified version of the Pathfinder scheme, a mechanism to capture everybody's process maps when they've done it, if they want to reshare it, as Larissa said, because the idea is to learn from everybody else's studies and work out when you've run a Pathfinder study and you found that you were looking to work out how you decided your core outcome measures, or what approach you used to decide what data management system to use, or how you came up with your data analytical plan. You came up with those bumps of like, I don't know how to do this, and then you solved that problem. And so the whole point really is to share with everybody else how you solved that problem, and then around that, this is how I solved the problem, to share the template or a training tool or a slide set, so that others can then say, oh, that's just like I've experienced in my study. Great, let me see if I can use that. So we hopefully over time will have lots and lots of Pathfinder studies that people have done, and then we can look at that. And so for Aashna, for her PhD, she's looking at applying a Pathfinder for lots of different groups working on snakebite studies, and she'll be able to they'll all be running their own Pathfinder study, but then Aashna can look at all of them and see if they came up with some common areas that they all found difficult, and see if there's a kind of overall, there's an overall way that people can find solutions. So I don't know if any of the other, Larissa or Aashna, want to add to that at all?
I'm guessing this is a really good question, Jackie, especially because it's always a challenge. And through the process, we have many questions. Like, for example, how detailed are we going to map the study? That was like the biggest challenge that we have through it. So the idea with the activities that we can walk with everyone who decided to use this methodology. And so the priority through all the process for us was to make sure that we were mapping the part of the study that the host study, that Birth in Brazil and Vacina Maré, were most interested to having mapped. I think that was the key for us.
Perfect. Thanks, Larissa. That's really excellent. We're going to try and end at 1:15 in just a few minutes. So, Sylvia, I just want to take your question, which, I might get Larissa to read this in English for us so we can all understand it. So sorry for my lack of language.
Yeah, of course. That's the challenge of that when we do 3 languages, right? But I think it's amazing how we can provide to have everyone open on this research. So Sylvia is asking, she says, like, thank you, this is really interesting. I have a question, if there is, or the necessity to have some databases or special places, a repository to register this type of studies on national and international level. So Sylvia, let me know if we haven't attended your question yet, but I think it's really connected to Alexandra's question regarding the repository. Where should we keep this? So I think that's something that you guys are asking, and I know the Fiocruz team is making sure that we have this on the chat. So we are bringing together all of the resources and the methodology, because they are at different places on the hub. So we have all of this on the Global Health Network Latin America and the Caribbean webpage. We'll find Proyectos Pathfinders in Spanish. And of course, when you click there, you can have it in English, in Portuguese, and Spanish as your own needs. And that's a commitment that our team has, that it's a challenge, but we try making all the resources on the 3 languages. So thank you so much for the question and having everyone so interested about it.
Excellent. Very good. There's one last question I'm just going to answer really briefly, because we're going to try and wrap up in a couple of minutes. But there was a really nice point about integrating rapid ethical analysis into the matrix. And that's really the point, that if you, like Jacqueline said, if you wanted to just pick that element into a study and really drill into it and interrogate it of what that meant, and just run that as a chunk of that piece of work that you've looked into and looked at that methodology, that would be absolutely excellent, and a really good example of applying Pathfinders to a really complex section of a study. So just to bring this together, we want to try and wrap up now, but we're going to run more of these, and we're going to come back again with our colleagues from Bangladesh, because it was really sad that that they missed out today, and there's some really exciting experience we need to hear from them. So those questions were excellent. You know, this is a really early journey in Pathfinders, as I hope you've heard, and we really hope some of you are interested in taking up this methodology, either at the deep, complex methodology level that the Pathfinders is intended to unpick to help understand how to run studies and capture each step that people have undertaken in running their studies. But also the slightly easier to apply version, which we're calling 1000 Challenge, which you can see on the platform now. So there will be a Pathfinder study up area up soon, but we can still work with everybody and capture what they're doing, even with what we've got now in the methodology area and in the regional hubs. So thank you, everybody, for your interest. Great presentations, everybody. Really great to hear those examples that everybody has been working on. Thank you, everybody, for taking part today and for the translators. And we will be sharing this webinar so other people can benefit from it in the future. And of course, thanks to the team behind the scenes doing a great job at keeping this running. So Louis and the team, along with the translators. So thanks very much, everyone. And we really appreciate everybody taking part. I hope you've all learned something.